Hi, everybody. Welcome back to the Adrenal Fatigue podcast. Today, it's me, Danielle, and I'm joined with Dr. Effy Germanis. Really excited to have a conversation today with you, Dr. Effy, about adrenal fatigue, hormonal imbalance, and the traditional Chinese medicine perspective.
Yeah, no, I'm happy to be with you today. I always love chatting with the adrenal fatigue group. And traditional Chinese medicine is it's really great part of therapeutic treatments that I use for my clients in naturopathic practice. And I always find that even if I'm doing a naturopathic intake, I'm always thinking about the traditional Chinese medicine approach in terms of how else can I understand their health concerns and their symptoms that they are experiencing. So it's a really great integration, and I'm very happy and honored to have been able to do both.
Yeah. Can you tell before we just dive into everything, can you share a little bit about like your background in like TCM?
Yeah, so I did my naturopathic degree actually in the States in Seattle, Washington at Bastyr University. And I had been intrigued by traditional Chinese medicine acupuncture then because a lot of our cohort of students were doing the dual program, which meant that they were doing an acupuncture master's as well as the naturopathic degree. And I kept saying, should I? And I kept saying, you know what, I can't do that right now. It's just too much overwhelm, which actually is probably a good thing because I did crash and burn during the program myself, dealing with that adrenal crash and thyroid crash that came with it as well. And when I returned back to Toronto, where I'm originally from, I found out that our curriculum here for naturopathic medicine included acupuncture. So I was like, oh, well, now I have to do it. So yay. And I enrolled at the Toronto School of Traditional Chinese Medicine up in Toronto area. And it's been a fantastic program. I love that I separated the two, but now integrate the two in practice. And I still continue to teach at the Toronto School of Traditional Chinese Medicine in some of their acupuncture classes. It varies from semester to semester. So I've been indulging in acupuncture in traditional Chinese medicine. And I just love integrating it. And I love educating my patients about, when we look at it from the traditional Chinese medicine perspective, we're still looking at it from the whole, understanding the whole person. But then we're also addressing it in a very different way, which can be kind of confusing for some. I think sometimes I go off on tangent, so I probably do confuse my patients slightly, but they do enjoy my examples and my little stories that kind of go in the traditional Chinese medicine perspective. So it's fun.
Yeah, I love that you integrate the two and that you were able to separate them and then now like understand them both so well and then tie them together. I think it's so powerful. And like you said, it brings a whole kind of other new dynamic to the and like a new level to the conversation. And I think that this is wisdom that's so like it's so interesting and so it just makes sense when you really like think about when you know a little bit about it, and we're gonna talk about it today, but like the way that it ties into stress and the way that it really looks at things holistically, like it's just nice to have this different school of thought coming in when, especially for our community who struggles a lot, we've read all the things on all the forums. There's so much different like information out there. It can be overwhelming. So coming back to kind of these basic foundations of like really old traditional medicine, that there's just so much wisdom in there. So yeah, this will be fun.
And it's been around for centuries. Like we've seen it work back when it first started, when it was first introduced, which we called medicine, and we still continue to do so. And the interesting part too is I would always love to go to China and see it in practice there, because I truly believe there's a lot of differences from the westernized traditional Chinese medicine and the way we use it here, versus going back to China, going back to its roots and seeing it in action by the practitioners in that country. And so I think there is some slight differences in that respect, just because it's a different approach to healthcare. And we see that when you go to Europe and you go to other countries, how do we approach healthcare in these different places? We start to see where those folk type of medicine, where it was traditional and was sent down from generation to generation, And here, yes, we have a different approach on what is seen as standard care, which I think is really important. But I that's one thing I would love to do once we're able to go and actually see it in action in its origin of country. So that's one of my to-do lists.
For sure. That was one of my like biggest kind of regrets after spending so long in Korea is I did go for like a traditional Korean medicine like first appointment, but to do the whole workup was it was so fascinating, but it was so expensive. So it was just a little out of my budget at the time. But they were like, we need you to come back every week. You're gonna like sit in this bath with like these different petals, and they were gonna make me certain tea concoction to drink. And while you're in the bath, give you acupuncture. And so it just seemed so cool and so different from what I know of as, traditional medicine here in Canada. But how do we tie it into everyday life? And what are the need to knows? Let's chat about this for our adrenal fatigue community, those struggling with burnout. I guess like what's if we're just kind of learning about traditional Chinese medicine, what do we need to know?
So, as I kind of said earlier, it's very similar. It's a holistic type of approach, right? So we're looking at the whole person. And again, as naturopaths, as nutrition, as a lot of our other disciplines, we try to understand how the body as a whole is working. And the main concept here with traditional Chinese medicine is we have this system or theory of channels and collaterals. And so when I'm first teaching acupuncture classes at the school, we introduce this theory, and I kind of give the kind of idea that it's similar to, you can think of it like our cardiovascular system, but for some people like, well, that's just equally confusing. So I think of it almost like our road system, our highways and our side streets and our main streets, and how we can get from one part of the city to the other part. And there's always these quick, we can take detours, we can take the main street where we can go faster or whatever it is. And so our channels and collaterals are the main ways we integrate the body from deep within, from the deepest aspects where our organs lay or are found, to the skin surface that separates us from our environment and protects us for those things around us. And so channels are these main highways, these main portals of where chi and blood flows. And our collaterals is kind of our networking system. The other picture that I tend to go to, because I feel that the roads are very industrialized kind of feel, is thinking about trees, trees lined up next to each other. And so each tree represents a channel. And that channel is that main strong branch, I guess, what's the part of the tree, that big part of the tree in the middle?
Oh, the trunk.
The trunk, thank you. I'm always like thinking the small words always like run away from me, but the trunks, right? These are our main channels, our main foundation. And so within the body, we have multiple trunks because we have multiple different channels. And then the branches that branch out, they're going to connect to the tree next to it. And so that's our networking system. Similar to how if we want to go into the endocrine system, you have the brain to the endocrine glands, and there's that communication. Communication happens through hormones. These channels and collaterals is what allows us to treat an individual. It also gives us an idea. It's the way the body communicates internally to external. So we think of it from the Western perspective as the visceral somatic approach. So the organ to the skin surface. And so what we have is, if my organ is not functioning, maybe it's not getting the right nutrients, or I'm overwhelming it, or there is some sort of physical change that has happened over time, it really can't, pick up a microphone and say, hey, Effy, you got to check me out. It'll show symptoms on the skin surface or deeper within, things like pain, skin irritations, mood changes, energy fluctuations. And so traditional Chinese medicine approaches the same way. And what we're talking about now is more of a balance of yin and yang, which we know we have that symbol that many of us know. But the nice thing is that we can't separate yin and yang, just like we can't separate the whole body. And so we have this continuous flow of yin and yang, and there's a point where yin is more prominent, and then there's a point where yang is more prominent, how one changes to the other, just like day and night, right? The sun rises and then it sets, and then we have the moon, and then the moon disappears and the sun comes back. So we have that similar type of succession, and we have that 24-hour daily cycle as well that we see in traditional Chinese medicine with the organs involved.
Okay, that's really cool. Thank you for breaking it down so clearly. So fascinating. It's kind of like the Google Maps, right? It's like the Google maps of our body. And when you say the different organs and like the different times of day and such, like these different rhythms, I'm just kind of throwing this question out there because this one comes up a lot because a lot of our community struggles with sleep issues. And so we always kind of come back to like that waking up at, we actually just did a podcast on this about reasons why you could be waking up at different times of the night. And we never really brought in, I don't think we ended up going into this area of the TCM perspective of like, it could be a different organ, you know, something with a different organ that might be the reason behind waking up at a certain time of day. So yeah, I know I'm just kind of throwing that out there, but is there like, what are your thoughts around that?
So before we step into like the organ that we would think about at night, in Chinese medicine, we actually only have 12 main organs that we describe, and they have their channels. And so we exclude some of the organs that literally we have in our body. And so we have, technically, we have what we call 6 yin organs and 6 yang organs. So that's the balance between yin and yang, and there's a relationship. And so we have the heart. So these are our yin. These are kind of our vital organs is the way I describe them. They're always full. They're always full of blood in a sense. So we have our liver, we have our heart, lung, pericardium, which sometimes gets disregarded because pericardium and heart kind of, you know, they're one and the same in essence. And then kidney, as well as spleen. So those are the 6 main organs there in terms of the vital yin organs. And then we have our 6 yang organs. And the way I kind of visualize them is the ones that fill and empty. And so we have our stomach, and we have our small intestine, and we have our large intestine, and we have our gallbladder, and we have our urinary bladder, and we have our, and then we have our sanjiao. This is something that actually doesn't physically exist. It's an energy. We don't have a sanjiao. There is no such thing as a sanjiao, but it's a triple warmer, triple energizer, and it affects all 3 jiaos. So we have our chest, upper jiao, our abdominal middle jiao, and then our lower urogenital section, which is going to be our lower jiao. And so when we talk about sleep, you know, when I have a patient come in and say, hi, I have insomnia, you know, I can't sleep at night, I wake up, or I have trouble falling asleep and I just can't stay asleep either. We usually are thinking the nighttime is the yin time. So this is kind of your blood, your substance, your fluids. And so when we tend to have things like heat in the body, or we have a deficiency in these fluids, like a yin deficiency, we start to see that people wake up at night. And this one example, and you know, I hate to use this as an example because it's not normal. This is something we should not advocate as being normal, but when women are perimenopause or menopausal, right, they get the hot flashes. They get them at morning, but when we think about them at night, the body heats up. And this is because we have this balance of yin and yang. And as I said, it fluctuates. So there's a nice harmony between yin and yang throughout the day. And so at night, you know, if we are yin deficient, say for any reason, whatever our reason is, that's something that's going to be determined by the practitioner, that yang could be normal, but in relation to the yin, it's an excess. And so now we feel hot at night. We feel restless. The mind wanders, and we end up waking up through the night or not having that satisfying, restful sleep. That's like an example of that. And so organs we think about, liver, heart, kidney, right? Spleen possibly as well, but those are the 3 main organs that come to mind.
Cool. So you can see how this is kind of a different school of thought around, I mean, when we talk about it, a lot of the times we're talking about the hormones, which I mean, can definitely tie in, but it's really cool to just think of it from this new perspective. And I think for people who have struggled for a while, it's something that it could be worth exploring. So when it comes to like the TCM thoughts, Effy, Dr. Effy, around fatigue, around insomnia, around like hormonal imbalance in general? Is there any commonalities that you tend to see?
So when we think about these organs, right? One kind of duo of organs that we kind of just we it's kind of hard for some individuals to be like, how does that make sense? Um, Spleen and stomach work together, and so what we have these relationship of these yin and yang organs, and they follow the five elements. So if you've ever looked at five element theory, we have wood goes into fire, goes into earth, goes into metal, goes into water, and we have this cyclical flow. And each of the elements is technically represented by two organs, a yin organ and a yang organ. And so when you look at those elements, earth element, think of it as Mother Nature, think of it as earth, the nourishment, right? We grow our food in the soils and we eat, and then we bring back, things like to nourish the soil so that way we can grow healthy food, for example. And so spleen and stomach work together. Now, stomach has the function of just literally breaking down the food, whereas spleen's function is to what we call the term transform and transport. And so it transforms this energy into chi and blood. And this is how we nourish the body, nourish the tissues and the cells and everything from the deepest to the most superficial. So in the same way that we think of the digestive system, the foundational aspect, it's the same approach. If we are eating fried fatty foods, if we're eating too much cold, temperature plays a really big role in traditional Chinese medicine, more than how we approach it from other types. But temperature of the food is very important, because if you've ever tried doing like a raw food diet, and especially in the winter, it can be really hard on the digestive system, especially someone whose system is already weak. And so in Chinese medicine, right, the temperature of the food plays a role, the texture of the food, the type of food, right? We're still looking at, are you eating well to nourish the body? Is it fatty? Is it dairy-like? Is it very mucus producing? Is it cold or is it too hot? Is it spicy? Does it dry up our terrain? So all of those different components can then affect the production of qi and blood, which is said to nourish the entirety of the body. And so in a case like fatigue, we may not be getting the nourishment. And so when I approach it with patients, because I deal a lot with gut disorders and gut dysfunctions in my practice, and how it relates to hormone imbalances and energy and sleep issues and pain, when we correct that digestive picture, that spleen, stomach, earth element relationship, we can start to see a lot of change. And then the other part is in this five element is that while there's that cyclical flow that we move, right? So earth is going to then nourish metal, which is going to be our lung and our large intestine. And then that's going to nourish water, which is our kidney and our urinary bladder. We also have this concept of controlling, right? Think of it as the controlling cycles. We want to make sure things don't go off uncontrolled. And so this is where emotions can also start to affect digestion. Have you ever, probably yourself have experienced, like if you've ever been super stressed out or super angry, what happens to your appetite? Do you get more hungry? Most people just have no appetite. They're like, I can't eat now. This is where the liver, because it controls spleen and stomach, can have an effect on our digestive functions as well, the liver, gallbladder. And so that's the emotional component as well, plus just how the organs are related to one another as well.
Okay, that's so interesting. So where does one start? Like if one's interested in exploring traditional Chinese medicine, or if like for instance somebody's listening at home and they're like,
Yeah.
okay, like I'm understanding a little bit more of the backstory of how this connects and what it is, and I'm stressed and I'm burnt out, like what can I do in my daily life to implement some of these ideas? Or if I want to learn more, what are the next steps from there?
So as always, and I think the Adrenal Collective group does it really well. Is there are some parts where we can just assess what's going on in our life. You know, Do you have kids? Do you have pets, right? There's equal as kids, I think sometimes. Do you have health issues that you're dealing with, not your own, but your own families? How are your relationships, not only with yourself, but those around you, right? Understanding your interaction with your environment. How do you deal with stress? How do you deal in situations where there could be like grief or sadness or excitement or anxiousness or fear? We have a lot of those symptoms or emotions, I'll say, that are popping up because of what's going on in the world today. So, understanding, just kind of sitting down with yourself. You don't have to write anything out, you don't have to do investigation, just kind of sitting with yourself and just understanding what is it that you're experiencing, what is it that you're feeling. When you think about certain people, you think about certain situations, how do you respond internally? I think you'll be the best at really coming down to and don't hide behind, oh, but this, don't give excuses. Just truly raw, how do you feel? This is how you're going to be quite open with yourself emotionally. And then also assessing, sometimes we feel that we might be doing well with our diet, but it can be hard to know what's really right for us, but making sure that you're actually eating right. I hate the term diet. I try to use the term like meal plans, because I feel like once I hear the term diet, that means I'm going to be restrictive. I'm
Yeah.
trying to change something from the normal that my life is going to be doing into something that's not truly long term attainable. But the term diet or food, right? We want to look at the way we eat our food. It I've gone and I'll eat something that we'll say is not that healthy, but at the same time, I'm also stating to myself, you know what? I'm going to enjoy this, and that's it. So when we start to have these negative emotions associated with things we do, we actually make the things worse. Um, but looking at the foods you're eating, being really open with yourself, where's your limitation with food, and where's your strength that you can change the way you eat or get more involved with it or find ways to be better with it.
Yeah.
Or just make sure that you're getting enough. So a lot of times we're not nourishing the body enough. We're overeating things that have very low nutrient value, and then not getting enough of the nutrients that our body needs. And don't forget, our soils have become a little bit more deplete in the main nutrients. And choosing where you can certain organic foods versus non-organic. You can do the dirty dozen, which is an easy way to approach it.
Mm-hmm.
But when it comes to something specific, like most of our communities dealing with things like fatigue, maybe they have anxiety, they're in that kind of revved up stage, or they're in
Overwhelm
the
is a big one.
overwhelm, or in that complete burnout. I don't want to do anything. All I want to do is sit on the couch, or I can't do anything. I just don't have the energy.
Yeah.
This is where it's kind of really important to just, find a practitioner um, that is open to understanding who you are and understanding that it's more than just giving you something, whether it's a medication or a supplement. That's not the real way to treat. It's to understand who you are as an individual, what your health goals are, and then understanding that you're going to make some changes. Right, we're going to address the lifestyle. Are you getting out, moving? You're going to address the emotional component. You're going to address the dietary component. So, working with an acupuncturist, working with a naturopath, working with a nutritionist, all of those are great options. Each person has their expertise in an area, and you can work alongside many of these practitioners. Some clinics have multidisciplinary clinics which offer all these services in one place. But if your interest is with traditional Chinese medicine, I think it's a really fantastic tool, because not only are you approaching it from the diet and lifestyle, but I really love, because I'm very much a physical medicine practitioner, hands-on. I love the acupuncture. I love providing, if I can, cupping or gua-sha. I do tuina, or more of the kind of type of massage manipulation, soft tissue manipulation. There are so many effects, and people are just kind of confused because they're like, well, needles are for pain. I use needles to treat anything and everything for patients. I've treated things from emotional distress to physical pain to digestive distress to insomnia. So acupuncture is a fantastic tool and modality within the traditional Chinese medicine that really looks at the whole person. But it does involve you going in to see your practitioner. In China, they might go see their practitioner 3-4 times a week. That's unheard of here in our Western colonies. But It's really great. Even if you're coming down with a cold, or you have hormonal issues, or you're female and your cycles are, I don't know, all over the place, and you're having PMS and you're having pains and you're having this and you're having that. Acupuncture and traditional Chinese medicine can be a really great way, especially to get started. And then if you're looking for testing and other support, that's where you're going to get into the functional medicine practitioners, naturopathic doctors, and your medical practitioners.
Yeah, I really love when the multidisciplines can come together and kind of come at it at all angles, and you kind of are tackling it in so many different ways.
Yeah.
And that was another cool thing in Korea. It was like so affordable to go for acupuncture, and they just like shine the red, like the infrared light on you. And I threw my neck out, and it was just so dreamy to like be able to just go so easily for acupuncture when you need it. And in fact, I remember when you were still in school, Dr. Effy, I came to visit you and I had a sinus infection. And this was my first kind of realization that, because we were working on some hormonal stuff when we were working together, but then I was there that day, I had something acute going on, and Dr. Effy stuck a needle in my, like, where my sinus pressure was, and like some other needles like all over my face, which was an experience.
I did your little whiskers, the Li-20 or Bitong, and then we did Yin Tang, which is our third eye. And then we did one up here on the just past the forehead into the scalp, and that opens up that nasal passage beautifully.
And it was like night and day difference. So this was my first kind of eye-opening experience that, wow, acupuncture can be like so instantaneous, because I literally felt that facial release from that pressure in my face, which what medicine can do that you can buy at the drugstore? Like, it was incredible. And so after that, I was totally sold. And I know, of course, the hormonal stuff can work a little bit more slowly, but I mean, it's just such cool wisdom. And I feel like it can work so beautifully into our recovery protocols and into our recovery journey. So I just think it's just so fun. And for people who have access to this, like, why not, right? If it calls to you. I feel like if it resonates with you and this is something you're interested in, then give it a try. Like, give it a try and see how you feel and what your experience is.
And yeah, one thing, a lot of people are fearful of needles, and to understand the difference, like I think I had seen a picture somewhere and I wish I had saved it. Not that you could see it here on the podcast, but we think of the needles like when you go to the doctor and they draw blood, or you go to the lab and they draw blood. When we talk about acupuncture needles, we're talking about millimeters in diameter. So if you take one strand of your hair, that is the width of most needles. These are very thin needles. So most of the time, what people experience, or what my patients experience, is possibly a little pinching sensation in certain areas like the hands and feet, because they're just a little bit more sensitive. Most of the time they're like, you put the needle in? I'm like, yeah, I'm all done. They're like, oh, when did you even start? So, there are a lot of sensations they don't feel. What they do feel, which is really intriguing, I love, because some patients feel it, some people don't. It's really dependent on the individual, but they can feel the flow of energy through that channel that we've opened, or that channel that we're activating. And I've had patient go, oh, that needle that's over there. And I'm like, here? They're like, yeah. I'm like, there's no needle there. They're like, I can feel it moving, this energy moving.
Yeah.
And it's really cool. And, you can, it's just, you said, it can be quite effective real fast, because there's a lot of ways to treat an acute onset of something. Hormones, chronic conditions, just like naturopathic approach, nutrition approach, does take some time, because you have to understand our hormones are in flux, right? We'll say every 28 days, we have this natural fluctuation, both for men and women. Men are a little bit longer cycles, but we still have this cycle. So we need to understand the fact that we have to work with the cycle, and the cycle is what takes time to work with, right? So when we think about hormones like sex hormones, or even adrenal, because we're not treating the adrenals. There's no adrenals in Chinese medicine, but I equate the adrenals with the kidneys, because that's where they're found. So when you're treating something chronic or something ongoing, I find that your treatments can take a little bit longer, but people tend to feel better sooner. symptoms do go away. The original cause of the problem may take a little bit longer depending on how complex it is, in the same way as we approach it from food, supplements, testing, all of those different pieces that we use. But you can have quite an effective response quite quick. Things like headaches, nasal congestions, acute onsets of your common cold, pain itself. I've used it for PMS for patients who have severe PMS. They come in, we do some needles, their PMS is gone. They don't need to reach out for the over-the-counter medication to get rid of the pain. So it can be fantastic in that way.
Yeah, when I think acupuncture and even working with our clients, like when somebody's experiencing a lot of pain or something acute, like an acute symptom like that, like the sinus congestion, acupuncture is a place my mind always goes, because I know that the relief that you can get from something like acupuncture and other manual therapies as well, depending on what's going on, of course, but it's just such a nice modality and something to have in your arsenal when you're working on something and you're working on recovering your whole body, right? And of course, working what you spoke about at the beginning, like figuring out and being brutally honest with yourself, like don't be without any shame or judgment, right? Like look at your life and look how you're reacting to stress and reacting to situations and what stress is for you, what your day-to-day is looking like, what's in alignment, what isn't in alignment. Like be really honest with yourself about what those stressors are. And then we can start, it's like an onion, right? Like then we can start like kind of peeling at which layer, and some of the layers are going to be more important for some than for others. And we can kind of like work with what layers are significant for one based on the situation. So this is really cool. So I know there's a couple different, like with TCM, of course, we're chatting acupuncture, but you mentioned the gua-sha, which is becoming so trendy now for our faces. But I think a lot of people don't realize that you can use it on your whole body, cupping. And of course, there's like herbs and teas. Like, can you just speak to those a little bit for the stress picture and like how it could support?
Yeah, so stress, the burnout, mental fatigue, exhaustion, all these different symptoms that many of our group members are experiencing, and many people who are not in our group are experiencing and should join our group. I know, I agree. um, so what we look at is, acupuncture is a fantastic tool because we can treat organ dysfunction, we can treat channel dysfunction. So if it's a pain picture, for example. Our other modalities like gua-sha. Gua-sha is literally scraping the skin surface. And so, yes, there is the cosmetic version where we can use like jade gua-shas. Jade's really nice, or there's the other stones, the different stones, just the temperature of them. So jade tends to stay cooler. And so especially if you have more swelling or say inflammation, it can help reduce that. And you'll follow the lines of the face to help kind of tighten. Acupuncture can also, there's a tool called cosmetic acupuncture. They just use smaller needles, and they actually put in, I don't do cosmetic acupuncture as of now, maybe in the near future, but one of my colleagues did do it, and you're putting like almost 100 needles in your face. Like they're very small needles, and it's so cool. And it can help, right? It's almost, it's the natural Botox, I guess you can say. It won't have as the same effectiveness, but it can be really helpful for those with, lines or wrinkles that they want to get rid of, or at least tame. But gua-sha itself, we're using it because it's almost like it helps with lymphatics to a certain degree as well. So kind of moving fluids and moving chi and blood in the region, so things are circulating properly. And then gua-sha on the body is the same concept. You can have different type of gua-sha tools depending what you want to use as a practitioner. They have different things like horns from a horn, or they have the jade. And so what you're doing is actually breaking, it's more superficial level, so more muscular level. You're breaking any type of stagnation, obstruction. So when we look at Chinese medicine in terms of, say, pain, I've taught the pain class at Toronto School of Traditional Chinese Medicine. And the main reason pain begins is that we have a change in the flow of qi and blood. Qi and blood should flow through the body without any type of obstruction or stagnation. Now, if we're deficient in qi and blood, it means we just don't have enough, so it becomes stagnant. If we have exposure to cold, cold has this sensation to contract. If we're eating things that are very dampening, or environment, like if you're stuck in water all day, that can start to create, again, another type of obstruction. It's very heavy. So all these different changes that happen in our body because of our environment, the food we eat, or underlying our vis, or energy, or underlying health, um, can start to create situations like pain. And so gua-sha I tend to use, especially on that superficial level. It does create a rash, right? Because you are scraping to bring blood to the skin surface to break this up. Cupping, I love as well. Cupping, the Greek term, because this is, a lot of cultures do use cupping, but we attribute it with Chinese medicine because it's one of the main ones. It's, the term is called veduges, and it's the same thing. It's the idea of suctioning out the oxygen from the cup using either fire or a suction cup, and it suctions to the skin, and so it feels like a nice massage. Cupping can be used in terms of like when there's an excess condition, for like if there's excess heat in the body from a common cold, or if there's pain, like obstructions, again, we use cupping on the back. And what happens, you have these nice, beautiful circular bruises that happen. And that's just bringing things to the surface to get rid of the excess in the body. So cupping has that. We've seen it on athletes in the Olympics. They've come out with cups now in, I think, heart shapes. I've seen star shapes, so it's kind of cool. And so you can do different types. You can do fire cupping, where you use the fire that sucks out the oxygen and there's a little bit more heat associated with it, or just your regular suction cupping. And I've done both. Fire cupping is really great. It feels like a really nice massage, but it's a little bit more general sensation, and it can be really effective. And then we also have Twina, which is similar to massage, but it's following channels and points. So it's following the channels and collaterals that we talked about, in terms of how we approach. It's almost like your acupressure meets massage, but it's a little bit more specific to what we find to be your problem, or your diagnosis according to traditional Chinese medicine.
I hope this is helpful for those of you guys out there listening who are wondering about like different approaches to fixing your hormones and dealing with stress and different modalities, right?
Yeah. No, and I think this is where you start to expose yourself, because you may not know what's available to you. And I always love that when I'm working with my patients, I can integrate the two really easily. And I pretty much 99.9% of the time do. I really do. Now, Chinese herbs is another area. It's out of my expertise, mostly because I did not get into herbology, mostly because the language was very hard and very hard to remember a lot of these Chinese herbs. But I do work with a colleague who does a lot with herbs, and they can be really fantastic, and another option, or another way to help heal that internal. The approach is very similar, right? We're making a diagnosis according to Chinese medicine to understand the terrain that we're dealing with. Is this individual deficient or excess? Is it a pathogenic invasion? Is it something else? And then the herbs are chosen in the same way as Western herbology, to have this type of action to clear heat, to build yin, to tonify, to nourish, and they can also be very helpful. And there's two ways to approach the herbs as well. You can either decoct them at home, which it's a practice in itself. You know, in China they do a lot of this, and prepare this medicine in their home, and it gives this aroma, maybe not always the best smell, but a strong aroma. Or you can always get the pre-made type of pellets that can also help as well. But herbology can be very helpful as well, especially if everything else you've been trying gives you some relief but not enough. It may be approach that starts to really hone in right into the cause, right? Because we want to approach a person not by the symptoms. What I always want to understand is who that person in front of me is. Who are they? Their personality, their likes, their dislikes, their health goals. What makes them angry, what makes them laugh, what makes them, all those pieces. The symptoms give me an idea of what's affecting their quality of life. And then, yes, I want to get rid of the symptoms, but if I treat the person, the symptoms will go away.
Love it. And what I love about this is in our community, I think a lot of people may experience that they're sensitive to certain supplements, like certain herbs, certain nutrients, maybe setting them off. And to be honest, this is much more common than you might think when people are really overwired and burnt out. And I think that this is what's really cool about homeopathy and things like these TCM approaches is it's something that you can do that can be supportive. That's not an expensive supplement that is really looking at your constitution and, like you mentioned, like who you are as a person. And it's something that you can do that you might not react as aggressively to as some of these other more maybe like different herbal formulas or really stimulating things out there, depending on what it is, but different supplements out there that might be just not the ideal thing for you at this moment. And I mean, we can get really creative with that. I'm sure in your practice as a naturopathic doctor, and even with mine as a nutritionist, working with people around those sensitivities, whether it's like micro dosing, looking for different forms of getting certain minerals, like for instance, magnesium, there's so many different ways rather than just taking it orally, right? We can use it as an oil. It's absorbed really good transdermally, just as an example. So it's just it's just one of those things that can be like very gentle, but at the same time supportive. And I think why not, right? If you're one of those people who is very sensitive, then this is like a really cool option to have on the table if you've never known about it before or if you've never considered it before.
Yeah, and when you go to do acupuncture, you have to go with an open mind. You may not notice changes right away. I've had patients who had optimal, for example, because, naturopath, we always talk about poop. They had normal bowel movements. We're like, no, everything's good. And we were doing treatments, but we were supporting the foundation in the treatment. That was not our goal. They're like, I didn't know I could poop better than I do. I was like, okay, that's good to know. And that just shows you a couple treatments in, and they were noticing that difference. Even they're saying, I didn't know it could be better. Right. So sometimes we just assume this is the best it can be. When in essence, our body is quite an intriguing system. It's just so fascinating. And, there's, get better, feel good, and then there's feel optimal. And that's my goal with my patients is we go through a process where we start off at dealing with what they are right now, getting them feeling better, setting them up for health goals that are attainable for them. I don't tell my patients to do things that they don't do. Like if they don't run, I'm not going to tell them to run a marathon to get healthy because that's not going to happen.
Right.
And then we optimize, right? We want to always optimize our health. We don't want to just think about now. We want to think about how can I optimize so I get older, more healthy. I age with resiliency. I age well, right? I feel my best. And sometimes we don't even know there's a possibility about it until we try it.
Yeah, that's another thing we're always saying too. And it's my personal experience is like, you didn't realize your baseline was here until you took something out or added something in. And then you realize like, hey, I could have actually been up here these last years. But then you discover like, okay, that's a really good improvement in your new baseline. That's a much stronger foundation to work from, right? A lot more vitality up here. So I love when people discover that kind of stuff. And that's what we love helping you discover in our coaching programs. So if you are out there, if you've been struggling, if you're feeling confused, we are here to support you in so many different capacities. So whether it's checking out our websites for different resources like meditations or adrenal loving recipes, joining our membership program where you can join a community where we'll just love you up, give you guidance, give you weekly support, or more immersive coaching where we do the testing, we look at everything like as a team. We work with wonderful doctors like Dr. Effy and other amazing, incredible integrative doctors across the states and do the mindset coaching and nutrition work that you need to really like tackle everything super holistically, but really in an, I want to say, underwhelming way, because our mission is to help you figure out the most important things to spend your little energy on. Because when you don't have a lot of energy, we need to just focus on what's going to get you results. And like you said, Effy, start getting you feeling better, and then we can optimize from there. Like that is so key.
Yeah. And always thinking positively. I feel that we're always our worst critic.
Yeah.
Right. We take a little thing and make it worse. So maybe we had a bad day. Maybe we ate something we weren't supposed to eat. It's okay.
Let it go.
Let it go. Move on. think positively. I think on one of my latest posts is like, think healthy thoughts, think
Yeah.
positive thoughts. Your body will represent the way you think. Your body will be represented by the way you think. So it's really important that we put that out there. And yeah, there's negative things in the world. Yeah, there's going to be things that are going to bring us down. And I'm not saying be full of it in terms of saying, oh, I'm positive, I feel great, because it's mostly just saying, I'm here, I want to be here. What do I have to change to get there?
Yeah, and we have some great chats with Angela, and there definitely will be more to come where we talk about the whole mindset piece in so much more detail. Even when you're stuck and things have been maybe pretty dark and heavy for a while, there's ways without like looking in the mirror and saying affirmations that you don't believe. Like we offer ways around that. And if you struggle with this, grab Angela's meditation album because she offers some really good trainings in there and really great guided meditations to kind of help shift you into a new gear. So there's so much that we could talk about if we go down that wormhole of mindset, but I'm really glad that you brought it up because it
Yeah.
definitely ties in. So where can we find you on Instagram and like how can we follow you?
My handle on Instagram, like, oh, that's a good question. Where do you find me? I'm joking. My handle on Instagram is Dr. Effy Germanis ND. I'm also the same as on Facebook. I think it's the same thing. And then I also have my clinic Instagram handle, which you can link from my personal. And then I do have my website, and I will be looking forward to having my full physical clinic in the next 3 or 4 months. It's under construction right now, so we'll be up in the Toronto Leaside area. But I'm still offering virtual care, through Adrenal Collective, right? Through our virtual care here in Ontario. I can only offer to Ontario residents, unfortunately,
Yeah,
though
for
would
our
love to help
local
everybody.
members.
Yeah, so for local members here, I know our team we have our support in the US as well. So check out all the links through Adrenal Collective.
Yeah, we
But
are
you
a
can check
global
out my handle.
team.
Yes,
Okay, and
yes.
all of your handles will be in the show notes. Before I
Okay.
let you go, I did pull up a quick like stat that I learned while I was in doing a pre and postnatal nutrition course actually about acupuncture. And this is something that can be really safe and effective for pregnant women, right?
Yeah. Yeah,
So
I do a
just,
lot for fertility, pre and post, even if it's IVF or just supporting natural fertility, both men and women, can be very, very fantastic.
yeah, so this really incredible stat that I wanted to share because fertility issues is another thing with our community with the hormonal imbalances, like this tends to tie in. So using acupuncture with pre and post within a couple hours of embryo transfer when you're doing IVF can actually increase success up to 65%, which
Yeah.
I think is mind blowing and so cool. Not only because that rate is amazing, like why not if you have the means to like get acupuncture before and after just to increase those odds if you're going through that process, why the heck not? But also because for pregnant women, oftentimes there's a lot of herbs and stuff that you maybe feel that you can't support your body through stress and discomfort as much as you would if you weren't pregnant. So something like acupuncture in this TCM approach could be really beneficial for all the pregnant or the moms to be soon to be pregnant women out there who
And
want some
postpartum.
support. Oh, and postpartum
Postpartum.
100%. Yeah, I'm really glad we brought this up because that's definitely a big part of our community too.
Yeah.
So we digressed a bit. We told you where to find Dr. Effy. Again, if you guys do need support, this is what we love doing. Work we like are thrilled to be here to help you out with if you are feeling lost or confused. All of the info is in the show notes if you need more. And until next time, thank you for being here today, Dr. Effy.
Thank you for having me. I always love being a part of the community and chatting with you always.